And we're back on Studio 10. Hey, you know, varicose veins are more than unsightly and oftentimes painful. But believe it or not, varicose veins can be dangerous.
That's because 90% of varicose veins are only visible by ultrasound and are often indicative of a more serious problem. And joining us today to tell us more is Kim Truitt, who is the vascular technologist and director of technical things at Mountcastle Vein Center, and Neil Shackleton, a patient that has been successfully treated. Hello.
Hi, how are you guys?
Good.
Director of technical things.
Yeah.
I like that. You've got a lot of responsibilities.
That was
Those are my several hats.
I went Yoda on you there. Director technical. That's backwards. So we talked. Basically, what we're saying here is that when you see varicose veins, you're probably to a point where you've got definitely a more serious problem going on underneath the surface.
It's true. It's true. A lot of varicose veins are caused by valves that have become, well, incompetent. So the ultrasound, which is a non-invasive test, it doesn't hurt, it tells us whether those valves in the veins are working properly. And if they're not, we're able to help these people that are not. We get patients all the time. They go to their doctor and they say, you know, doc, why is my leg swelling? Why is my ankle swollen up? What's the problem? There's nothing wrong anywhere else. Why is it my foot hurts? And the doctor says, well, I'm sorry, all I can do is give you some Lasix and maybe that will help you. You know, we could help these people, and they don't, it's not that their doctor doesn't want to help them, they just don't know.
Right.
Now, this has come a long way in the last few years, and again, varicose veins, it's not just like the little purple spider veins. I mean, these things can get, as you were saying, really swollen up, and there can be, is it like blood clotting and so forth?
They can clot, and if they cause a clot on the surface, you can kind of feel them, and the clot can actually go down into a perforator, into your deep system, and cause what's called a pulmonary embolism, which are clots in your lungs that are actually deadly. It's very dangerous.
So that causes like a heart attack, or you can't breathe, or what does that do?
You can't breathe. It actually, it goes through your heart chambers because they're so large, so the clot goes into the lung, and then you've got this breathing problem.
Now, Neil, you didn't have anything that quite extreme, but you had varicose veins you were a teenager.
Yeah, I got them at 19, and I had them stripped out with the old process, and it was a 6-month recovery.
And it's painful, isn't it?
And it was really painful, and I said, I'm never going to go again, and because it was hereditary, it came back. And my dermatologist took a look last year and said, you really need to get this sorted out because you could suffer from the thing that Kim was just talking about. So, yeah, that's how I ended up at Dr. Mountcastle's.
And Kim, what is the Dr. Mountcastle process versus the vein stripping, which is the old-fashioned way of doing things?
Real simple. No scars, no pain. So all we do is start an IV. We put a laser fiber inside the vein that has the problem with the valves.
A laser fiber?
Yeah, the laser fiber actually fuses the vein shut and forces the blood to take the other veins that are working properly. So you no longer have night cramps, you no longer have swelling, no longer get these varicosities that are down your leg.
So you don't take it out, you just kind of, you just cut it off and then it stays there, but you never see it.
It actually fuses shut, and the brain doesn't get scared that it's lost a road. So, you know, later on down the road, like Neil, he ended up getting more varicosities because of the strippings.
What in the world were you doing, Neil? What were you guys doing? You're just on your feet all the time.
What is your job?
I tell you what, this process was unbelievable, right? When they say that they're going to, you know, put a laser in and do this procedure, it's a panic, and it's just, you go in there and it's like a 20-minute deal, and there's really no pain, and you're at work at the end of the same day. And
you're skipping out of there. When you're done, you skip out, everything's good, you don't have crutches or anything,
and then,
right?
Then the cool thing, at least for me, is all of a sudden, because that main vein is now closed up, all the other veins that were failed also don't have any blood supply, so they just kind of dwindle away. And, you know, my wife, my mom, everyone's going, oh my goodness, you know, why didn't you have this done 20 years ago? And it's like, well, it wasn't available.
Are you winning like best legs contest?
He's our poster boy.
Yeah, there you go. Well,
yeah, not quite there.
Sometimes you can't see the problem from the outside, but a lot of times you can. We're going to take a look at some before and afters that have been treated at Mountcastle Vein Centers. And obviously, this is a giant improvement from the before here, Kim.
Yeah, this was a big improvement. One treatment, the person was able to have the laser and everything shrunk down. This one needed a couple treatments, the laser, and then he needed to also have an ambulatory phlebectomy that just pops the vein.
An ambulatory phlebectomy, that's exactly what I thought when I looked at that. Obviously, that's an ambulatory phlebectomy.
Jerome knew exactly what was going on right off the jump go.
So here we go, and again, obviously, the before on the left.
You can tell this person is now wearing shorts. They're tan.
Clearly.
Right, yeah.
Yes, and I know that a lot of your patients have walked out feeling much more confident, too, to go out and be able to feel like they can show their legs off again. Was that the case for you, Neil?
Yeah, sure. I mean, you know, as I was meeting new people, I used to be conscious about it, and now, you know, you wouldn't know me from a guy that didn't have this hereditary thing, right?
Mm-hmm.
And you even, again, you brought your mom over. You were so happy with the procedure at the Mountcastle Vein Clinic. You brought your mom over from England and say, Mom, you got to get this done.
Well, it was better than that because my mum came over from England to visit, like you do, and she's like, what's happened to your legs? I never even said anything to her, and of course it's hereditary, so she had the same deal. And so she also followed up and went to the same place.